Hello everyone, welcome to my channel for nursing exams learning. Today in this video we will discuss a question related to neonatal abstinence syndrome. In the previous video we have studied what is neonatal abstinence syndrome and what are the clinical features and what the treatment and how we should find out and what are the interventions the nurse should carry out if she suspects such symptoms. So we'll start with the question. A client without prenatal care gives birth to a newborn at term gestation. The client denies opioid or other illicit drug use during pregnancy. When monitoring the newborn, which of the following signs would indicate neonatal abstinence syndrome? To the nurse, select all that apply. So the question, they said 2-3 scenarios or a group of points. The first one that the mother, she was not getting the regular prenatal care. And another one that the baby delivered as a tame neonate. Then the third point that if the mother or the client denies the use of opioid or any illicit drugs during the pregnancy period. So we got 3 points from the first 2 sentences of the questions. Now we keep these points, never mind. Now we'll come to the question. When monitoring this newborn, which of the following signs would indicate neonatal abstinence syndrome to the nurse? So now the nurse is doing the assessment and she found some symptom or a group of symptoms that indicate the child may have neonatal abstinence syndrome. But the mother, she refused. She told, I didn't use any opioids or illicit drugs during her period of pregnancy. Even though we should check when we should do the further interventions and investigations. So we'll see the options. For option 1, irritability and restlessness. Option 2, meconium ileus and floppy muscle tone. Option 3, microcephaly and cleft palate. Option 4, nasal congestion and frequent sneezing. Option 5, poor feeding and loose stools. So what do you think? Which all are the answers based on the knowledge that we have discussed on the previous video? The option 1, irritability and restlessness, that is a correct symptom. We studied it is related to the neurological signs and symptoms of abstinence syndrome. So option 1 is a correct statement. Then option 2, meconium ileus and floppy muscle tone. Okay, what do you have idea about this particular signs or symptoms? Meconium ileus, it's not related to neonatal abstinence syndrome. Then it's related to what? It is a typical classic sign of cystic fibrosis. And the floppy muscle tone, that is a typical finding for a child with trisomy 21 or Down syndrome. So this option 2 is not directly, or it's not a sign or symptom that indicate the child have neonatal abstinence syndrome. So we eliminate option 2. Now we'll see option 3, microcephaly and cleft palate. So what is that? When we will see this microcephaly and cleft palate? For the mothers, those who have a prenatal exposure to teratogenic agents, what all are those? Like alcohol, cytomegalovirus, and intake of some valproic acid medications. So if they are using such, or if they are exposing to such things, there is a chance that the child may develop microcephaly and cleft palate. So option 3 also not a symptom or sign that indicates neonatal abstinence syndrome. So now we have eliminated option 2 and option 3. Option 4, nasal congestion and frequent sneezing. Yeah, that is a correct statement. That is related to the NAS or neonatal abstinence syndrome. That is the symptom we studied. Then option 5, poor feeding and loose stool. The gastrointestinal symptoms are poor feeding, diarrhea, and the child not tolerate the food. So the child should be provided with the small and frequent meals. And the diarrhea should be protect the skin also. So our answers are option 1 irritability and restlessness, option 4 nasal congestion and frequent sneezing, option 5 poor feeding and loose stools. So these are the symptoms or the findings that indicate the child may have neonatal abstinence syndrome. Please study this topic thoroughly. I have seen some questions related to this, and the question are select all that apply questions. So you should have a clear idea. Then only you can pick all the correct answers. And now you also got the idea what is meconium ileus, in which condition you will see meconium ileus, in which condition you will see block P muscle tone, and when the mother will exposure to any alcohol or cytomegalovirus, there is a chance of developing microcephaly and cleft palate in the newborn. Hope it's clear to everybody. Please study, and I wish you all the best for everybody.